So have been working on this problem now for 24 years. We developed in 1981 the first study of a drug to actually try to treat Alzheimer's disease. The study on that particular drug has now led to 4 drugs that are now FDA approved for the treatment of Alzheimer's disease, and we believe that those drugs make patients a little bit better and do have a slower course of Alzheimer's disease when they are treated with these medications. But that's just the start. It doesn't really stop the disease or completely prevent it. But the information that has been learned about Alzheimer's disease over the last 25 years has been truly astounding, extremely exciting. It looks like there are particular mechanisms in the brain that we have learned about that help us understand what memory is and how people learn. And we are starting to understand exactly which of those processes are affected by Alzheimer's disease. And we are starting to understand that there are particular medications that we can give, recommendations that we can give to patients that seem to be able to have a specific and very significant effect on the disease. For example, one of the recent studies suggests that the patients who have arthritis that are taking anti-inflammatory drugs, and particular anti-inflammatory drugs such as Motrin, which is ibuprofen or Advil, and maybe an aspirin along with it and something to protect the stomach, seem to have as much as a 90% decrease in their risk of getting Alzheimer's disease. This, along with the medications that are available and the cholesterol medications that seem to have an effect on the disease, I am strongly expecting that by the year 2010 that we are going to have substantially reduced the risk of getting Alzheimer's disease. But right now what we're thinking is that we have to be able to define the patients that have mild memory impairment. Something has recently been referred to as mild cognitive impairment. So this is a problem that seems to be the very earliest stages of Alzheimer's disease. And if we can give patients specific medications that have these early symptoms, and we can slow, or we hope stop, the disease process, that's going to have a major impact on just the people of San Francisco that have the risk of getting Alzheimer's disease, the 1 million people that are at risk here. If there's nearly 300 million people in this country, that means there's at least 30 million, actually the number is 40 million people over the age of 60 that are at risk for getting Alzheimer's disease, and it's estimated there's 4 million Alzheimer's patients in this country. The thing that we're seeing is that the cost of taking care of these patients is about $120 billion a year. Older people are one of the greatest resources that we have in this country. We're not computers. We're people that as we get older, we get more and more experience. And the people who are the oldest have the most experience. They are our greatest resource. If they get Alzheimer's disease, or if they have memory problems, like at least half of people over the age of 80 have memory problems. If we can eliminate those, think of the tremendous benefit that this will be to our whole society.